I'm Thomas. I'm the founder and principal of the College of Cranio-Sacral Therapy, which I started as the first college of cranio-sacral therapy 36 years ago. And you will have seen my colleague Lisette there up on the screen. So Lisette, do you want to just say a little bit about the technique, the technical aspects of the evening for everybody?
Yeah, so I'm Lisette, and I'm one of the tutors with the college, and I'll be managing all the little technical bits today. So if you have any questions as we go along, there should be a little row of a chat box. If you're on a laptop or if you're using a tablet or iPhone, maybe under participants, it might give you the option to chat. So you can write in anything to the chat, either to me directly as a question or to the wider group. And we'll be able to ask that for Thomas. And
usually when I do introductions, I like to start straight away with practical sessions when we do the live in-person sessions. And of course, we've got a live practical introductory day coming up in a couple of weeks' time on Saturday, the 4th of September. And it's always lovely to dive straight into the practical aspect of craniosacral work, because that's the best way to understand it. Now, obviously, we're not going to be able to put our hands on each other on this Zoom session, but I'd still like to do something practical to give you a sense of it. So what I'd like you to do is just settle into a comfortable position wherever you're sitting, and just bring your hands up to rest very softly, very close to, but not quite touching your head. So you can be in touch with your hair maybe, but not gripping tightly, not holding, but just letting your hands rest there very softly. Not the most comfortable position to be in, so we won't stay here for very long, but let your shoulders relax and your arms soften as much as you can while keeping this position. And then notice anything you can feel in that space between your hands. You've obviously got your head there, but what else is there? Can you feel any sense of movement, any sense of activity, or is it very still? Does it feel hard or does it feel soft? Does it feel tight or does it feel loose? Does it feel as if there's a lot going on there? Or is everything very quiet and peaceful? And take a deep breath in and let go of your breath completely, letting your shoulders and arms soften. And let your contact become a little bit lighter so that you're barely touching the hair. See if that affects what you're feeling at all. We all have a biomagnetic field radiating some distance from our body. In fact, each of us is a biomagnetic field, full of all sorts of forces, movements. You might feel buzzing, you might feel vibration, you might feel other activity, you might feel a sense of magnetism, pushing your hands away or drawing your hands in. You might feel things swirling around, or things might just feel very tight and solid, or still and peaceful. There's no right or wrong or good or bad. It's just a matter of recognizing that there are things going on there that we're not usually aware of. And let yourself settle into a deeper, more meditative state, not looking for very obvious characteristics, but being open to more subtle forces, movements, the movement of energy. You may feel it, you may not. Don't be concerned about it either way, just notice whatever's there. And then, as I say, this is not the most comfortable position to stay in, so we're not going to stay there very long. When we will do it in practice, you'll be working on each other or lying on the couch, so it will be much more comfortable. But for the moment, you can gently let your hands float away from your head and come back down again. So, how many of you felt something going on there? Anybody want to put a hand up? Yeah. Yeah. Anybody like to describe what you felt?
Well, I felt magnetism, as you said, like at some point, my hands are hold in that place. And it's difficult to bring them closer, but they feel like being pulled apart. And heat.
Mm-hmm.
And something live, very pleasant for the feeling. Sensation.
Good.
Very
Yeah,
good.
thanks for that. And did that surprise you that you felt those things?
No, it didn't, because I felt them before, and I can feel them, but I am happy that I can feel them more easily with time. This is yeah.
Great. Anybody else want to describe what you felt?
Yeah,
I was quite similar. So you go on, Lisa.
Okay.
Okay, Lisa.
Yeah, it was similar. I wanted to say that I felt, first of all, heat, and then it was like I was holding a fuzziness under my hands. But I think Misu probably described it a bit better than me. So yeah, I felt like a force. Yeah, it was really nice.
And are those things you felt before?
Not that particular thing, no.
Yeah. Good. And Julie, what did you feel?
It was similar. It was like there was a certain point at which my hands didn't want to go in and they didn't want to go out. It was like if I tried to move, they were sort of relocated to that distance from my head. I have felt something similar. I've sort of done some intuitive energy work with my husband. So I've not really done it to myself, but I have felt that sense of energy working with him. Yeah.
Great. So yes, as I said, we all have a biomagnetic field which radiates some distance from our body, and each of us is a biomagnetic field. Every part of our body is a part of that biomagnetic field, and there are countless things going on there. Just the natural expression of life is there in our bodies, but also everything about us, everything that's ever happened to us, every injury, accident, emotion, stress, everything throughout life is in that magnetic field as well. And it can be measured with magnetometers, but it can also be felt very clearly with our hands. And as craniosacral therapists, we can pick up all sorts of things that are going on. And as Mishu was saying, that with more practice and experience, you start to feel more and more and more until you can read somebody's whole life story by just engaging with that biomagnetic field, feeling all the different qualities, asymmetries, and movements going on in there, and working with those or allowing those to be expressed in order to help the process of the therapeutic process of reorganization within the system. So that's what we're engaging with when we work with craniosacral therapy. And so let's have a look at what it is that we're working with. And I'm going to present this first bit on video because I felt that was the easiest way or clearest way to present it. So I'm just going to share my screen for a moment and we'll go into a video.
A while ago, a little girl called Amy was brought to see me. She was 6 months old and she had been screaming non-stop for the whole 6 months. Day and night, night and day, all day, every day, she screamed and screamed and screamed. She'd seen countless doctors and specialists. She'd had endless medication. Nothing had helped. Her poor parents were at their wits' end, desperately concerned for their little girl. They'd hardly had any sleep in 6 months. They couldn't take Amy anywhere. They couldn't have friends around. Life was a continuous nightmare. And they were on the point of splitting up. Then somebody suggested craniosacral therapy, and they brought her to see me. They arrived with Amy screaming as usual in obvious, inconsolable distress. They laid her down on my treatment couch. I put a hand over her abdomen, a hand over the crown of her head. Within a few seconds, she stopped screaming. Within a few minutes, she was asleep. And from that moment on, she was a happy, healthy little girl, growing up just like any other healthy child. Her parents stayed together. They had another child. I saw Amy and her younger brother from time to time as they grew up happy and healthy. Life transformed from the nightmare of those early days. We see stories like this quite commonly in craniosacral therapy. Not always so dramatic, not always so fast, but often apparently miraculous. So what was happening during those few minutes? What was happening with craniosacral integration. The cranial concept originates with William Sutherland. In 1899, as a student osteopath in Kirksville, Missouri, Sutherland looked at a cranium and saw that it was clearly designed to move. Conventional anatomy books stated clearly that the bones of a human adult cranium don't move. They're simply a solid box to protect the brain. But Sutherland realized that the cranium would not have evolved in this way unless there were movement. He explored this concept, he experimented on himself, he experimented on others, and he identified a subtle rhythmic motion of expansion and contraction, expressed not just in the head, but throughout the body. Sutherland dedicated his whole life to developing this concept. As an osteopath, he started from a more bony, mechanical perspective, but as time went on, he increasingly realized that the movement he was feeling was not coming from the bones, membranes, or the fluids. It was emanating from a deeper source, generated by more profound forces of nature, part of a wider field of biodynamic forces that pervade the universe, what Sutherland called the breath of life. In 2013, Professor Peter Higgs won the Nobel Prize for a concept he first put forward in 1964, and for which the experimental proof was provided by the CERN laboratory in Switzerland in 2012. Higgs postulated that there is a universal field which pervades the whole universe. It's now well established in quantum physics that there is a universal field, and that everything exists within that field and interacts within that field. Every galaxy, star, planet, solid object, living being, every cell, molecule, atom, and subatomic particle. Within craniosacral integration, we also recognize a universal field, a unifying matrix within which we all exist. And each of us exists as an individual matrix within the wider universal matrix. Just as in the oceans, sea creatures exist, each having their individual nature, influenced by the currents, tides, waves within the ocean, so we as human beings, each exists within this wider energetic matrix, this cosmic ocean, influenced by the waves, tides, currents, and biodynamic forces which pervade the universe. We are formed embryologically, developed, maintained, and sustained by these biodynamic forces. And every cell, molecule, atom, and subatomic particle in our body is a part of that wider field. This field is composed of the electromagnetic and other forces which pervade the universe, the forces which are the basis of physics, chemistry, and biology, the same forces which have led to the evolution of life on Earth, and which continue to sustain us. These natural forces determine the progress of growth, development, health, and healing, whether in an acorn, enabling it to grow into a magnificent oak tree, or in a human being, enabling our progress from embryological development and throughout life. As craniosacral therapists, we engage with this field and we interact with these forces. And these forces are expressed in the body as rhythmic motion.
Okay, so I'm going to go on now to a PowerPoint. So again, I'm going to share my screen.
And just a note, do feel free to feed in. So if you are having any issues seeing anything, or if there's any aspects that you can't hear, just let us know. So sometimes we can lose the presentation if we don't have it on full screen, and that goes for the sound as well. So, but if you do have any individual issues, hopefully we can try to talk you through them.
Okay, thank you. Yes, so here is a picture of William Sutherland, who I mentioned in that video. As I said, in 1899, as an osteopathic student in Kirksville, Missouri, he looked at a human skull and recognized that it had clearly evolved to move. Having experimented on himself and others, he identified this subtle rhythmic motion being expressed throughout the body, not just in the head. As an osteopath, He initially tried to explain this movement from a more bony biomechanical perspective. But as time went on, he increasingly realized that that movement was not coming from bones and membranes and fluids. It was emanating from a deeper source, generated by more profound forces of nature, part of a wider field of biodynamic forces that pervade the universe. And Sutherland called this the breath of life. And there you can see Professor Peter Higgs, who won the Nobel Prize in 2013. And in 1964, he put forward this concept that there is an invisible field that pervades the whole universe. As time went on, the experimental proof for that was provided in the CERN laboratory in Switzerland in 2012, and it's now well established in quantum physics that there is this invisible field within which everything exists. In craniosacral integration, we also recognize a universal field, a unifying matrix, and each of us exists as an individual matrix within this wider matrix. Just as in the ocean, sea creatures each have their individual nature and are washed this way and that by the waves, tides, and currents of the ocean. In the same way, each of us exists as an individual within this wider cosmic ocean, this energetic matrix, influenced by all the forces, waves, tides, currents, and biodynamic forces within that universal field. And this field is composed of the electromagnetic and other forces, the same forces which are the basis of physics, chemistry, and biology, which have led to the evolution of life on Earth, and which determine life, growth, health, and healing. And these forces are expressed in the body as rhythmic motion. There are, of course, many rhythms within the body: heartbeat, breathing, diurnal rhythms, many different rhythms. But there are three rhythms which are specific to the cranial concept: the craniosacral rhythm, the middle tide, and the long tide. The craniosacral rhythm has cycles of around 5 to 10 seconds in which the body seems to be gently expanding and contracting. The head can feel like a balloon, gently expanding and contracting. The movement is rather like waves rising onto a beach and ebbing away again. And then there's the middle tide with longer cycles of around 20 to 30 seconds, which can feel more like waves that seem to roll across the surface of the ocean before fading into the surface. And then at a deeper level, there's the long tide. And as its name suggests, this has a longer cycle of 100 seconds. And this is a very even, balanced rhythm that is present in all living matter and maintains that same rhythm throughout all forms of life. It's rather like the tides rising and falling in the ocean. We can't see it rising and falling, but we know the tides have risen and fallen. And we can feel it in the craniosacral process. Now, these rhythms are very subtle. Many people might doubt their existence. But as long ago as 1954, Professor William Seifritz, professor of botany at the University of Pennsylvania, showed on film that all forms of life are expressing subtle rhythmic motion. Seifritz actually worked with something called a slime mold. Have any of you ever heard of a slime mold? Probably not, although in fact it's very common. You find it growing all over the place on rotten logs and tree stumps. It's a fungus, a very primitive form of life that seeps through the wood. It's so primitive, it doesn't even have a cell structure. It's just protoplasm, the basic material of which all life is formed. And even this very basic form of life is expressing rhythmic motion. Seifritz created this film, which is about half an hour long, so I'm not going to show it to you now. But that picture at the bottom there shows an excerpt from his film in which he shows the various rhythms being expressed by this slime mold. And he concluded that all living matter is expressing rhythmic motion, not just one rhythm, but multiple rhythms. Now, rhythmic motion is significant in cranial work, but it's by no means the whole story. James Oschman is an eminent biologist and physiologist, and he's written an excellent book called Energy Medicine, The Scientific Basis. It's a wonderful book, firstly because he's an eminent scientist, but also because he gathers together all the evidence and material for the kind of things that we feel in craniosacral therapy and in other forms of energy medicine. And he shows the scientific basis behind that. Oshman describes the body as a coherent living matrix. In other words, the human body is not just a collection of separate structures, bones, muscles, skin, blood. It is a coherent living matrix. Everything is cohesive, part of one integrated matrix. It is, of course, alive. Every cell, molecule, and atom is a part of that matrix. All of them are in constant communication and interaction with each other. So I'd like to read you a few excerpts from Oshman's book. When you touch a human body, you are touching a continuously interconnected system composed of virtually all the molecules in the body linked together in an intricate webwork. So in other words, as craniosacral therapists, when we take up contact on the head, the sacrum, the feet, anywhere in the body, we're not just feeling one part of the body, we are feeling that whole interconnected system, and we can read everything about that system. Oshman also describes how research laboratories around the world are now measuring biomagnetic fields. Magnetometers are now being used in medical research laboratories around the world to map these magnetic fields produced by physiological processes inside the human body. These fields give a clearer representation of what is going on in the body than classical electrical diagnostic tools such as the electrocardiogram and the electroencephalogram. So these fields are very clear, they can be measured by scientific instruments, and they give us a clearer picture than the currently used tools such as electrocardiograms and electroencephalograms. They tell us much more about the body and about the disease processes within the body than all those currently used equipments. So another quote from Oshman: Harold Saxton Burr, professor of anatomy at the University of Yale School of Medicine, implemented a series of studies on energy fields. He obtained evidence that abnormal fields show up before serious pathology sets in, and that balancing or restoring the field can reverse disease processes. Now, of course, balancing and restoring this biomagnetic field is exactly what we're doing in craniosacral integration. And there is evidence to show that this can reverse disease processes, can prevent disease processes, can create health. And one final quote from Oshman: electromagnetic fields emitted from the hands of therapists are capable of producing biological effects. The low frequencies in the range of 2 to 30 hertz emitted from the hands of therapists are beneficial. So again, there is evidence that this is not our imagination, this is not witchcraft, this is not anything that is non-scientific. It is a natural radiation that emerges from our hands that we are able to use in a therapeutic way as craniosacral therapists. Now, we're working primarily with biomagnetic fields, but there are also more biomechanical models for explaining the craniosacral system, explaining it in more conventional physiological terms, through the movement of bones, the fluid pressures which are exerted on the bones, the neurological processes that regulate those fluid pressures and such like. And these are useful, particularly for those who need a more physiological explanation. And they also are valid and relevant. There is definitely movement of the bones and movement of fluids, but these models reflect Sutherland's early explorations. As he progressed through life, he realized that things were happening on a much more subtle level beyond currently understood physiology. And so these explanations, they're valid, but they have their limitations because they don't adequately explain all the phenomena that we experience in craniosacral work. We can explain craniosacral therapy in terms of its anatomy, the bones of the cranium and sacrum, the membranes which connect those bones, the cerebrospinal fluid contained within those membranes, and the fascia which emanates to all parts of the body. And all of this is absolutely relevant, but it extends way beyond that. In order to understand cranial work, we need to think on a quantum level. How many of you have a pretty good understanding of quantum science? Any hands going up? Perhaps not, and that's a good answer, because Richard Feynman, eminent quantum physicist, said, if you think you understand quantum science, then you don't understand quantum science. Quantum science is, of course, beyond current human understanding. The world has always been a quantum universe since the dawn of time, whenever that may have been. It's always operated at that quantum level. It's only in the last 100 years or so that quantum science has come into being within human understanding. So we're just at the very beginning of understanding such things. But we are still working with them. Life still exists on that quantum level, and we are working with those subtle forces, those nuclear forces, and those quantum forces. So when we think on a quantum level, we can see that all matter is composed of atoms, which are in turn composed of subatomic particles. But what is an atom? You may remember from school days seeing physics books with a picture of an atom, rather like that picture at the top there, with a nucleus at the center representing the solid part of the atom with a few electrons around it. And once again, that is in some ways valid, but it's a somewhat outdated view, because in reality, the solid part of an atom is 1/trillionth of its volume. A tiny, tiny, tiny portion of the atom is actually solid. Every atom is composed primarily of space. The solid part, the nucleus, is just 1/trillionth of its volume. 99.99999999999% of the atom is space. You may have come across the analogy between an atom and a football field. An atom is, of course, a tiny, tiny, tiny microscopic structure. But if you were to think of an atom as being the size of a football field, the solid part, the nucleus, is the size of a pinhead in the middle of that football field. Everything else is space. There are, of course, a few electrons floating around in that surrounding space, but they've been compared to a few flies buzzing around in a cathedral. So every atom in our body is composed primarily of space. That means that our bodies are therefore composed primarily of space. Of course, they don't feel as if they're composed of space. They feel very solid. But that's because there are very strong forces, nuclear forces, holding those subatomic particles together. And it is those forces which give that apparent sense of solidity, which prevent us from being able to penetrate the structure of the body. But even those tiny particles are not really solid. It's often said in quantum physics that there is a duality between waves and particles. What that means is that sometimes they behave like particles, but sometimes they behave like waves. They keep changing from moment to moment. Particles are, in fact, coming in and out of existence trillions of times every second. That's so fast we can hardly conceptualize it. What it means is that in its essence, all matter is energy coming in and out of existence at every moment. So as human beings, we are waves of energy rather than solid objects. And the human body, despite its apparent solidity, is in fact a biomagnetic field. So in craniosacral integration, we interact with the wave-like fluidic motion of the patient's quantum being. The therapist's more integrated wave, in training with the patient's more disturbed wave and the surrounding universal forces, in order to enable reorganization and reintegration, and to restore balanced, healthy function. And that's what was happening with Amy, who we met in that video at the beginning. Amy had had a very difficult birth, a very traumatic birth. Her whole system was severely traumatized. Her nervous system was highly overstimulated. Her autonomic nervous system, particularly her sympathetic nervous system, the fight and flight part of her nervous system, was very agitated and disturbed. It's no wonder she was screaming all the time. She was living in constant fear and terror. And obviously there was nothing, any medication or any doctor could do about that. But craniosacral integration could engage with that trauma, release the shock and trauma from her system, and enable that reorganization and reintegration so that she could come back to being a healthy, happy, comfortable child again. Now, the fact that we're working with these subtle forces doesn't mean that conventional anatomy, physiology, and pathology cease to be relevant. On the contrary, they're extremely relevant. We need to know our anatomy and physiology very thoroughly in order to make the most of craniosacral therapy, because they are fundamental to the way we work. It is, after all, through the physical body that we experience life. If you get hit on the head with an iron bar, it's not much consolation to be told that that iron bar is composed primarily of space. It can still hurt, it can still fracture your skull, it can still kill you. So we need to take into account health and ill health on every level, quantum and Newtonian, biodynamic and biomechanical, subtle and gross. And here at the College of Cranio-Sacral Therapy, we practice craniosacral integration, which integrates all of these different levels to the optimum, bringing together the biodynamic and the biomechanical, the quantum and the Newtonian, understanding all the different aspects of health, not restricted to one form or another, but covering the whole spectrum in order to be able to respond to each patient at the appropriate level in whatever way is most suitable. And thinking on a quantum level, we also need to take into account that thought is a part of that quantum interaction. Thought generates electrical charges in the biomagnetic field. When we can identify and focus our attention on anatomical structures in detail, this influences the therapeutic response. And this is something you'll readily understand once you start the training in craniosacral therapy. You can be sitting at the head, feeling what's going on, and you can take your attention down the spine. You can feel what's happening at different parts of the spine, and you can feel changes happening in response to your attention, noticing different vertebral levels. You can do the same with the organs, with any injuries, with anything that's going on in the body. And you will very soon recognize this and feel that response to your attention and therefore knowing your anatomy is absolutely crucial so that you can identify these different structures and that your attention and your consciousness can be brought to those structures in order to influence them. So anatomy, physiology, pathology are all crucial, but the craniosacral process goes way beyond anatomy, physiology, and pathology. So what is the craniosacral system? It's sometimes portrayed like that picture below there with the cranium and the sacrum, which are obviously likely to be relevant in terms of the name craniosacral system. We also have the structures that connect them, the membranes that go from the cranium to the sacrum, the fluids contained within those membranes, and various anatomical structures can be seen as part of the anatomical craniosacral system. But the craniosacral system is not just the body. It's not just body and mind. It's not even just body, mind, and spirit. Within craniosacral integration, we define the craniosacral system as the whole person within the context of their life. In other words, everything about them, physical, mental, emotional, spiritual, their lifestyle, their family, their environment, their history, their emotions, their responses to their environment, their whole interaction with the world around them. All of that is part of what we feel and pick up and engage with in the craniosacral system. So when you engage with the craniosacral system, you can feel that person's birth, you can feel their childhood, you can feel their current emotional state and their past emotional state. You can feel every injury, illness, shock, and trauma that they've ever experienced is all embedded there in their biomagnetic field in some form. So you can read their whole history, their personality, their whole being, everything about them. Their whole life story is there to be read. And you can not only read the life story, you can engage with it in order to enable a therapeutic response. Craniosacral integration is not a technique that you do to somebody. You're not manipulating, you're not massaging, you're not doing anything at all. It is an interaction with a living being which has its own powerful inherent potential for healing within the context of the surrounding biodynamic forces. So the body has this inherent potential for healing. It has a natural tendency towards reorganization and reintegration of body, mind, and spirit, an integration back to health. Just as an acorn knows how to grow into an oak tree, so our bodies know how to grow and heal. But that healing potential can be depleted and overwhelmed by the many things that we impose on our systems, the many traumas, injuries that we experience, the excessive demands that we put on ourselves, the way we exhaust ourselves through our lifestyles, through burning the candle at both ends, working too hard, the accumulated stresses of day-to-day life. All of these deplete our healing potential. But by engaging with the biodynamic forces within and around the body, we can enhance and restore that inherent potential for healing, re-establishing the fluent, life-giving flow of the breath of life throughout the body. Now, of course, in day-to-day life, we're not usually engaging with all these forces. Engagement is enabled by establishing a very calm, quiet presence, settling into profound stillness, and listening attentively to the subtle biodynamic forces within the craniosacral process. So we need to settle into that stillness to feel these subtle forces being expressed. Everybody is capable of engaging with them. Any living person, any living creature can engage, and in fact is engaging with these systems, but on the whole, we're not conscious of it. But through training, practice, experience, we can engage with these forces and help that therapeutic process to happen. And our consciousness is a huge part of that. As Dr. Bruce Lipton has said in his book, Biology of Belief, we now live in a universe where science and spirituality are one and the same. Energy, fields of information, consciousness, and physics, rather than chemistry and pharmaceutical drugs, become the primary tools for health and healing. So as quantum science develops and as craniosacral integration develops, we can see that so many things that would have been described as spirituality in the past can now be seen just as aspects of science. And that is what we're working with. So anybody got any questions on what we've covered so far? We're going to be dealing with various other things as we go back to the PowerPoint, and we'll talk about the trainings and things, but any questions arising from what you've seen so far? Put a hand up if you want to speak.
You can also put up a virtual hand. I know, Sharon, you did that before we moved on. So do feel free. There should be an option for you to put your hand up electronically if you're using a laptop.
So everything's totally clear to you, is it? You all understand the quantum science and everything else about it completely? No.
I think it is very interesting. I have
Good.
no question.
Thank you.
But it's very interesting, really.
Good. Thank you, Mishu. Okay, so the next question on the PowerPoint was, I think, what can we treat with craniosacral therapy? Any suggestions?
Yes, I'm thinking first trauma.
Yeah, absolutely.
And I'm not thinking physical trauma, but emotional trauma, all kind of trauma that is not seen from the outside.
Mm-hmm. Yeah, that's absolutely true. Anybody else got any suggestions?
My feeling would be that you can treat just about anything, really. If the whole story is in there and you are sensitive enough and experienced enough to read it and interact with it, then you literally have access to everything, don't you?
Absolutely. That really sums it up very well. So as you say, we can treat anything or everything. Just one thing about that is, of course, that we're not treating things, we're treating people. So yes, we can treat everything, but of course, the essence of cranial work is that we are enhancing the underlying health in the person rather than trying to treat the symptom or treat the disease or treat the injury or the trauma. We are engaging with the person, and that will bring about the therapeutic process that will resolve the symptoms and conditions. Okay, so let's go back to the PowerPoint then. Okay, so as we were saying, what can we treat? Craniosacral integration can be beneficial for anyone, whatever their age, whatever their condition, whatever their circumstances, from newborn babies to the elderly, to those who are severely traumatized, to those who are dying, to those who just have minor illnesses and ailments, whatever it may be, because everybody can have their health enhanced. We're not treating the condition, we are engaging with people. And when we enhance the underlying health, we enhance the body's inherent potential to reorganize and reintegrate, to heal itself, to resolve the conditions and symptoms insofar as possible. Now, of course, patients don't tend to come in and say, please, can you enhance my underlying health? That's not the way patients think or talk. They're concerned about their symptoms. They say, can you sort out my migraines? Can you help my back pain? Can you resolve my child's asthma? Can you help my menstrual disorders? Whatever it might be. And we need to, of course, talk in a language that they will understand. If we just say to them, oh, I don't treat symptoms, I just enhance underlying health, they'll probably go away and think you're a bit weird and find somebody who talks more sense. So we need to, of course, speak in their language. We need to say, yes, of course, I can help your migraine, your back pain, your menstrual disorders, your child's asthma, whatever it may be. But we know that we're not treating the condition. We are enhancing the underlying health. And everybody's health can be enhanced, whether it's physical, emotional, whether it's long-standing trauma, whether it's birth, whatever it might be. As Julie said, you can engage with the whole system, you can engage with whatever's happened in their life, and you can help it to come into a greater state of health and balance. We can treat everybody, we can treat every situation, but some circumstances and conditions tend to attract attention more, and craniosacral therapy is often better known for certain types of situation. For example, babies. Babies, of course, always tend to attract attention. I mean, just look at a picture like that and think, oh, babies, obviously everybody is interested in babies. And so craniosacral therapy has become very well known for treating babies, partly because, as I say, babies always attract attention, partly because of the apparently miraculous effects we tend to get. Most obviously with the babies who are suffering a lot at the time. How many of you here are mothers? You've got quite a few mothers here. Those of you who are mothers will know that most babies cry, often cry quite a lot, often don't sleep very well, often scream, often have colic. And that's so common that it's really regarded as standard. But it doesn't have to be that way. And we see such rapid results with babies with colic, with poor sleep, with agitation, with hyperactivity and such like. Generally, pretty much every baby and child will respond very quickly, not always as quickly as Amy, but generally becoming much more settled, much calmer, sleeping much better, and relieving all those very common symptoms of colic. But it's not just about relieving those symptoms. When you treat a baby and relieve those symptoms, you are changing that baby's whole future. Those symptoms are generally the result of birth trauma. They are generally indications of things that are going on in their body that will affect them for the rest of their life. They might lead them to have digestive disturbances, headaches, all sorts of conditions, severe conditions, less severe conditions. If you resolve those things at an early age, those things that are manifesting as agitation, hyperactivity, colic and such like, you are not only helping that baby to be much more settled and comfortable and happier in its early life, but you are changing its whole future as well. Partly changing its future by changing its physical state, but also a happy, settled baby attracts a whole different level of attention from its surroundings than a screaming, colicky baby. So the whole way that that baby and child grows up is going to be different. I mean, as I say, craniosacral therapy tends to get well known for certain conditions, partly because they attract attention, like babies and children, but also often because they're conditions that don't respond well to orthodox medicine. I mean, you take babies and children to doctors for colic and such like, and as most mothers will tell you, they'll be given medication, but it doesn't usually work. There's nothing much that doctors can do for that sort of thing. Whereas craniosacral therapy really helps it. So word soon spreads around, and GPs, doctors will say, a mother comes in and they'll give them the medication, but say, actually, it might be a good idea to see a craniosacral therapist because they, I've heard they're really, really good for colic. Now, in the same way, there are other circumstances, like, for instance, the chronic effect of meningitis. Now, meningitis is, of course, a potentially life-threatening infection. If you have a severe bacterial meningitis, it's probably a good idea to go to a doctor and get antibiotics to deal with the acute phase. But so many people suffer long-term effects from meningitis and other similar infections, effects which tend not to be recognized and not understood, but can be very debilitating. The typical effects of severe meningitis are severe headache, severe neck pain, pain behind the eye, brain fog, difficulty thinking, difficulty being able to do anything. I've seen so many people in this situation. One good example would be a woman I saw who was in her 40s. She'd been in this state for over 10 years. She'd had meningitis 10 years ago. She'd been to the doctor, she'd had the antibiotics, but she was suffering all these continuing symptoms ever since. She was in a very bad way, living on painkillers for the severe headaches, completely unable to work, unable to go out of the house. She, of course, went back to the doctor. The doctor said, "There's nothing wrong with you, nothing to do with the meningitis. The tests show nothing. It's obviously psychosomatic," referred her to a psychotherapist. She knew perfectly well that it was nothing to do with being psychosomatic. She knew it had started with the meningitis, but the doctor wouldn't acknowledge it, couldn't do anything. When she came to see me, I could, as soon as I put my hands close to her head, I could feel immediately these severe effects of the meningitis, the chronic contraction of the meninges. The meninges are the membranes which surround the brain. They were very tight, very contracted. It's no wonder she was experiencing such pain and such brain fog. And within that first session, there's a huge transformation, a huge weight lifted off her head. Her life already improving enormously. Took about 5 or 6 sessions altogether to clear the effects completely, and she could go back to work, back to a healthy life, give up all the painkillers. Now, I've seen that situation so often that I've written an article about it, describing those symptoms, describing the way you go back to the doctors and get no response, and they get referred to psychotherapy, and that's all that happens. And I've written this article, and I get emails from all over the world, from so many people saying that's exactly my story as well. It's exactly what happened to me, and I'm getting exactly the same response from doctors. Please tell me where I can find a craniosacral therapist who can help with that. So these things are very common. And there are so many situations like this which are not helped either by orthodox medicine or often by many other therapies, which can be really transformed through craniosacral therapy. So, talking of meningitis, I saw a little boy a while ago who was 15 months old when I saw him. He had been born a perfectly happy, healthy baby, easy birth, slept well, fed well, did everything a baby should do. But at 3 months old, he contracted bacterial meningitis, went to the doctor, antibiotics, dealt with the meningitis as far as the orthodox medicine was concerned, end of story. Except that from that moment on, he was a completely different child. Constantly restless and agitated, never sleeping for more than an hour, waking up every hour through the night, screaming as if he was having nightmares. He shared a room with his brother, so his brother was being woken up, his parents having to come in all the time. Life was just completely disrupted and disturbed. And this just went on and on, month after month. They obviously went back to the doctor. The doctor said, nothing to do with the meningitis. He's just a crying baby. He'll grow out of it. But they said he wasn't a crying baby before the meningitis. It obviously started with the meningitis. Doctor wouldn't do anything. They went on for a few more months. They went back to the doctor. They said, please, can you refer us to somebody? Ever since the meningitis, he's been in this state. He's still waking one every hour, every night. What can we do about it? Doctor said, nothing wrong with him. He'll grow out of it. No point in referring you to anybody because there's nothing to refer you for. So finally, after a year, through their own efforts, they discovered the Meningitis Trust. They contacted the Meningitis Trust. The Meningitis Trust recommended them to me. They arrived, and by this time, of course, he was not a baby, but a toddler, 15 months old. Still this same restless, agitated boy, wouldn't sleep, wouldn't stay still, never sleeping more than an hour each night, or throughout every night. And so they arrived, and this little boy spent an hour running around the room, pulling down the curtains, knocking over tables, wouldn't sit on his mother's knee, wouldn't let me touch him, just frantically moving around the whole time. So we spent an hour with that. And at the end of the session, the parents said, I'm sorry if we wasted your time, but there's nothing we can do. This is what he's like the whole time. I said to them, don't worry, come back in a week's time. Let's see how he is. So they came back a week later, and they said that that night after the first session, he slept solidly for 15 hours. slept so deeply that they were quite concerned whether he was still alive, had to keep going and checking that he was breathing. Of course, he was breathing. He was a much more settled, happy baby. By the time they came back the next week, he was a very different child, happy to let me contact him, happy to sit on his mother's knee, much easier to treat in a way. Obviously, things not totally resolved yet, probably took about 7 or 8 sessions altogether before he was back to being a healthy child again. So, of course, the crucial point about that story is that you don't have to have your patient lying still on the couch. You don't have to have your hands on their head or anywhere else on the body. We are working with a biomagnetic field. You can engage with a biomagnetic field from off the body. You can engage with a biomagnetic field with somebody else in the same room or even not in the same room. So the power of craniosacral integration goes way beyond physical contact, which of course makes it a very valuable resource at any time, particularly of course at a time like this in COVID. We can work more distantly and such like. So yes, it's very valuable to have that potential for working in that way. So while we're talking about children, another child I saw, which exemplifies much of what craniosacral can do, was a little girl who had glue ear. Anybody know what glue ear is? Some of you may do. It's not an ear infection, but it's a condition in which fluid accumulates within the ears. Because it's not an infection, it doesn't cause pain, it doesn't cause inflammation. There are no external symptoms, just a gradual deterioration in hearing. Now, with adults, they will probably eventually notice that they're not hearing so well, but it's very common in children. And in children, of course, they don't know their hearing's deteriorating, and it's often not recognized. It can go for months, even years, without being recognized. Parents think the child's just being disobedient and not listening to them. Teachers think the child's not paying attention. And of course, this poor child is just not hearing what's going on around, not able to interact with its friends. And so this can deteriorate steadily with nobody recognizing it. And this is what was happening with this little girl. She was about 4 or 5. And it had finally been recognized. Her hearing had been deteriorating. It was quite severely deaf in both ears, but had only just been recognized. And they'd been to the doctor, and an operation had been suggested, but the first operation would be in 6 months' time. So with glue ear, what doctors can do is they can open up the eardrums, pierce the eardrums so that the fluid can be released, and that sometimes restores the hearing, at least temporarily, but very often glues up again, because of course it's not addressing the source of the problem, which is the natural drainage of the ears through the eustachian tube from the middle ear through to the nasopharynx. So we've had many people who've had those operations, and it's either not helped, or it's helped temporarily, or it just keeps coming back time after time. Now, in craniosacral therapy, of course, we're not just going to address the ears, we're going to address the whole person. When somebody has glue ear, there's a reason why those eustachian tubes have become blocked. And generally, like so many things with children, like so many things with most people, it comes down to birth trauma. So with this little girl, I didn't just treat the ears, I treated the whole system. And I could feel all the effects of birth trauma in her system, the tight solar plexus, the tightness in her chest, the tightness up through her neck and head in the base of the skull, which was blocking those eustachian tubes. There was no point in treating the ears without treating everything else. I explained this to the father, because it was the father who brought her for the first few sessions. I said it would probably take a little while, because not only do we need to release all the underlying trauma and tension in the system, but even with the ears, once they do start draining properly, the epithelium needs to recover, and that can take a few weeks. So I worked, and I could feel everything improving, and I reassured the father that although the hearing might not be returning yet, things were definitely changing, and I was confident that everything would be restored. And on the 4th session, it was the first time the mother came in, because she'd been at work the first 3 sessions. And as she arrived, she said to me, thank you, thank you, thank you so much for giving me back my little girl. She's a different child. I mean, her hearing still isn't really back, but she's just so much happier, so much more confident. She's playing with other children. She's completely different. Thank you so much. And of course, again, the crucial point about that story is that if that little girl had had the operation, it might have helped her hearing, but it wouldn't have changed all the other things, the physical things, the withdrawn nature, all the other things that went along with that. Those would have affected her for the rest of her life, even if her hearing improved. So fortunately, she didn't have the operations. Instead, she had craniosacral integration, which enabled that transformation in her life. So I want to tell you about one more child. And this is a little girl who was autistic. And autism, of course, comes in many different levels of severity, sometimes very severe, sometimes quite mild. She was in quite a severe state, very withdrawn. She was 5 years old. When she first came along, I came out into the waiting room and she was curled up in the corner of the waiting room, trying to keep hidden, wouldn't look at anybody, wouldn't make eye contact at all. She wasn't speaking at all at the age of 5. This very, very withdrawn girl in a state of shock and trauma. Her mother gently coaxed her into the treatment room and up onto the treatment couch. And she was very timid and not wanting to be there at all. And then as I brought my hands into gentle contact with her, you could just see her whole body language changing. You could see, although she wouldn't look at me, she wouldn't make any eye contact, I could see in her face and her eyes this change, saying, I like this, this feels good. And her body relaxed and everything started to soften and her whole system started to change. And you could see that she was really recognizing that craniosacral therapy was something that felt really good for her. So there was a huge amount going on, extreme tightness in her whole abdomen, severely constipated, very common in autism, a lot of tightness and restriction and trauma and shock held into the whole system. So worked away at it on that first session. I explained to the mother, autism can take a long time, but I feel, we can help her as long as you're happy to come to regular treatment. So she came back the next week, and as they arrived for that second session, where I work at my Center for Cranio-Sacral Therapy in Primrose Hill, I can see out the window to see people arriving at the clinic coming up the street. And as they turned the corner, I could see this little girl racing up the street as fast as she could, bursting in through the door, bursting into my treatment room, jumping up onto the couch, saying, treat me, treat me, treat me. Except, of course, she wasn't saying it because she still couldn't speak. But everything about her was saying, I want more of this craniosacral therapy. And so we worked with her regularly, week by week, and gradually things progressed. After 2 or 3 sessions, I would see her looking at me, and then as soon as I met her eyes, she would quickly turn away and pretend she wasn't looking. And then another week or 2 later, she would look and she would actually keep eye contact for a while and smile. The other thing that happened after that first session was that she'd been having regular speech therapy for 2 years, but still not really making any progress at all. And her mother said that after that first cranial session, she went to the speech therapist the next day. And after the session, the speech therapist said to the mother, what's happened? She's suddenly responding. She's suddenly making more sounds. She's responding. It is wonderful. So again, some things were happening almost instantly. And then as the weeks went by, you could feel everything changing, and particularly the physical tension dropping away. Her whole abdominal tension became much better. She'd been a very sort of alarmed child initially. Any loud noise, particularly something like a fire alarm or a burglar alarm going off, could send her into panic and leave her there for days. But she was now becoming much more settled. She was responding to these things much more calmly, recovering much more readily. So I continued to treat her quite regularly for about 2 years. As I say, autism, you don't expect instant results, but the results were obviously happening steadily, bit by bit. By that stage, she was such a different child. She was at a normal school. She was talking pretty well, not quite what you'd expect from a 7-year-old, but still just such a different child, and making huge progress. after that, they moved abroad, so I didn't see her anymore, which is a pity. But you know, she'd already made such wonderful progress that it was just great to see. So this is the sort of thing we see in craniosacral integration on a regular basis, treating children. And of course, I've chosen to tell you a lot of stories about children there because they're very good examples, but the same applies to adults as well. Then I'll tell you a few adult stories. When I say adult stories, I mean the stories about adults later as well. So yes, let's go back to the PowerPoint now and talk about a few other things. Right. So I want to talk a bit about fascia. What is fascia? Can anybody define it?
Is it a membrane that envelops the muscles, or that define muscles?
Yes, that's partly true. Well, it's true in part that certainly you have fascia enveloping every muscle, but it's not only every muscle. Fascia is a connective tissue, as you say, a membrane, which envelops everything in the body, every bone, every muscle, every blood vessel, every nerve, every organ, everything is enveloped in fascia. And it's there right under the surface of the skin, the superficial fascia. It's covering everything in the body as deep fascia, and it goes right down to a much deeper level, enveloping every tiny little part of the body. Now, fascia has been regarded for a long time as this connective tissue, but as long ago as 150 years ago, Andrew Taylor Still, the founder of osteopathy, made many various profound statements about fascia. There are many of them, but perhaps the one that sums it up best is the soul of man seems to dwell in the fascia. If our soul is in our fascia, that suggests that our fascia is reasonably significant. And it is highly significant because it's not just connective tissue. It's now, and just recently in the last 10 or 20 years, research has shown that it has remarkable properties that make it probably the most important tissue in our bodies. It's been dismissed just as packing material, the stuff that fills the spaces between the important things like nerves and muscles, but it is in fact this hugely important tissue throughout the body. Firstly, it is the tissue that holds us together. It maintains tensegrity, keeping us in that balanced state of being able to operate and function in a smooth, fluent way. It also transmits forces and injuries throughout the body because fascia is there from the top of your head to the tips of your toes and everywhere in between. If you sprain your ankle, that's going to affect the fascia right up to your neck. If you twist your neck, it's going to affect your back. If you have an operation, the scar tissue is going to radiate out to all parts of the body. And this explains so many things that people get from operations and injuries that don't otherwise make sense. But as I say, it also penetrates deep into the tissues. It's not just enveloping muscles, it's enveloping each bundle of muscle fibers, it's enveloping each muscle cell, has its own fascial sheath. With nerves, it's not only enveloping the nerve, it's enveloping each bundle of nerve fibers, and you have fascia around each individual nerve cell, microscopically small. But it doesn't even end there. Fascia penetrates the cell membranes to enter inside cells and penetrates the nuclear membrane to enter the nucleus of the cells. There are molecules called integrins, which enable that transition from outside the cell to inside the cell. So the fascia is passing from the skin right down to the inside of every cell in our body. So when we contact the skin, we can influence the DNA within each cell of the body. This is why fascia is so profound. This is why craniosacral integration can have such profound effects. Even that is not the full extent of its depth, because fascia is actually creating the matrix which is us, within which we exist. It's the matrix within which everything, every cell, every molecule, every atom, every subatomic particle is contained within this cohesive, interactive matrix, which is our fascia. Our fascia is carrying fluids, is carrying energy, carrying electromagnetic forces, carrying biodynamic forces and communicating them throughout the whole body. So it provides its own communication system throughout the body, completely independent of the nervous system. And this communication is global communication, not whereas nerves just take things to a specific area. The fascial connection sends messages throughout the body. It sends electrical charges throughout the fascial sheath, throughout the fascial matrix, and so has profound effects in communicating throughout the body, from every cell to every other cell, and enabling us to function fluently and smoothly. It also has its own sensory nerve supply, a larger sensory nerve supply than our eyes or our fingertips or our tongue. We get more sensation from our myofascia than we do from any of those other tissues. It also has particularly significant connections with the autonomic nervous system, a vital interaction between the sympathetic nervous system, the fight-flight part of our nervous system, and the fascia. And of course, when we're going to fight and flight, that stimulates the sympathetic nervous system, and that is immediately affecting the fascia, causing it to contract, causing it to become agitated. So every stress, every trauma is embedded in our fascia, which has huge implications for treating fascia, for treating trauma, and for working with the fascia in order to address trauma. It also means that it carries emotional tensions and it retains tissue memory. In other words, it holds on to both physical trauma and emotional trauma in the tissues, so that when we work with the fascia, we can release that physical memory and that emotional memory simultaneously. I'll show you some examples of that in a moment. Now, despite all this research and understanding, most approaches to the fascia remain predominantly mechanical. Myofascial release is a wonderful therapy that is spreading around the world very effectively, but it is essentially a mechanical approach to the fascia that massages and manipulates the fascia and stretches the fascia. What we do in craniosacral integration is something completely different. It's fascial unwinding, and it can be profoundly transformative for a whole range of different things, from musculoskeletal injuries, chronic pain and restriction, emotional tension, trauma, and for overall integration of the body-mind. You won't necessarily have your patients flying through the air like that picture, but it can be quite like that. It can have all sorts of wonderful effects. But this is a completely different approach, a unique integrated approach engaging with the body's cybernetic systems. The cybernetic systems are the automatic control systems within our body. And when we work with the fascia through fascial unwinding, we are engaging with those cybernetic systems and changing those underlying control mechanisms, and therefore changing the trauma patterns and the injury patterns at a deeper level, rather than just changing what's happening on the superficial level. Unfortunately, fascial unwinding is hardly taught at all. They're certainly not widely taught, and not taught even within most craniosacral trainings. There are a few that teach it, but for the most part, fascia is not really treated through fascial unwinding, which is a great pity because it is so powerful and so valuable. And the approach to fascial unwinding that I've developed at the College of Cranio-Sacral Therapy is particularly specific to working with these things in this more profound way. Before we talk about trauma, I'd like to just show you a couple of videos to show you what fascial unwinding is like. Lizette, do you want to just talk a bit while I get these fascial unwinding videos ready?
So just to refer to some of the questions as well, so I'm trying to answer those. First, in regards to fascia, there's a great video that you might be able to find on YouTube called The Mysterious World Under the Skin. And they go into all of these different tests that they do on fascia, but they note the fascia is actually more innervated than the muscle itself. So they were making these connections between back pain not actually having to do with the muscles of the back, but in regards to stress on the body, actually stress causing tension in the body itself. So so I would say that anything that has any kind of stressful impact on the body, you'll definitely see an impact on the fascial system in particular.
Great, thank you. So you might think, looking at this, that initially that I was moving the arm, but as you can see, My hands have come away from that arm, and it is to a large extent moving of its own accord. So you might think, well, if I'm not moving it, the patient must be moving it. But she will assure you that she's not doing anything. And this is what you'll find in fascial unwinding, that the body just has this ability to move on its own, particularly through the fascia, because it wants to release the traumas and tensions that have accumulated there. And in its own wisdom, it knows far better how to release those and where it needs to go in order to release those than any human mind can ever know. So when you create the suitable circumstances, the body will start to unwind, and it will find its own way to those positions in which it was traumatized in order to release them. And as it does so, it will make connections with those cybernetic systems within the body. It will change those patterns. And as I say, it's not me moving the arm. It's not the patient moving the arm. The fascia will move of its own accord. It will reach the point it needs to get to. And the tensions and traumas will release in a more profound way than any physical manual therapy could ever do. So here you can see an unwinding of the neck, and the same applies. You might think I'm moving that head, but as you can see, my hand contact is very light. Obviously, I am needing to support the head off the couch slightly, otherwise it would just be stuck on the couch. But I'm just providing support. I'm not initiating any of those movements, nor is the patient. The head is just moving of its own accord, releasing the tensions and traumas in the neck and throughout the body. And once again, the body knows in its own wisdom where it needs to go, far better than anything any therapist could do. And it will find those subtle details that it needs to unwind and unravel in order to release deeply embedded trauma, whether it's current torticollis or a long-standing injury or birth patterns, whatever it might be. Okay, so I'd like to tell you about a couple of examples of some fascial unwinding. I've talked about the way it works and how it involves a bit more movement and how it engages with tissue memory and such like. So a while ago, I was treating an elderly man. He was 67, and he had had a headache for 10 years. Not headaches, but just a headache. It was there when he woke up, it was there when he went to sleep, it was there all day, it was there all night. And he just was living with this severe pain the whole time. He had, of course, been to doctors, he'd been to therapists, he'd tried many different therapies, homeopathy, acupuncture, lots of different things. He'd been through his case history time after time, and he couldn't think of anything that had happened that could have caused it. He hadn't had any injury at the time 10 years ago. He hadn't had any sort of illness of any kind. And yet this headache had just suddenly developed 10 years previously and had been there ever since. So when I engaged with his system, again, I went through his case history. He said he couldn't think what could have caused this. Nothing had happened at the time of the headache starting or any time near. And I engaged with his system, and in looking at the system as a whole, I could clearly feel that his head and neck were pulling very strongly down into his right shoulder. And as this was fascial unwinding, I allowed the head and neck to move and to twist and to compress down into the neck. But this was a very forceful pull. It felt to me like there'd been a very heavy blow to the top of the head. And yet he insisted that he couldn't remember anything like that ever happening, certainly not 10 years ago when this headache had started. So I stayed with this, and it went deeper and deeper and deeper into this pull and twist down into that right-hand side. Finally, it reached this point of stillness, and it shuddered a little bit. And at that point, he suddenly shouted out, "Of course, I was blown up in the war, you know." And it turned out that back in the Second World War, at the age of 19, he had been blown up into the air, come crashing down on his head. At the time, of course, people were being killed all around him. People were losing limbs. He just had a bang on the head. He just got up and ran for his life and did whatever he needed to do and forgot about it. It just wasn't particularly significant at that time. It was only 40 years later that the tensions that had gradually accumulated in his head and neck had started to manifest as this headache. And he couldn't, he obviously had no reason to think back to that injury because he'd completely forgotten about it. Nothing else found any, no other therapy would trace this, but fascial unwinding has this unique ability to allow the body to go into the pattern that it experienced, to reconnect with that pattern, and to bring up the memory, and as it brings up the memory, bring up the physical release. With him, it wasn't a particularly emotional memory. Sometimes it is a more dramatic emotional thing. For him, it was just this memory popping out from years ago that he hadn't thought about for years. And as the memory came up, the physical tissues released and everything started to improve and his headache went away. And that's very typical of fascial unwinding. Sometimes with far more severe things, as I say, when working with severely traumatized patients, that whole process can be very valuable, helping to engage with the trauma, but obviously in a very careful, subtle way that helps the patient to cope with it and not to be re-traumatized in any way, but in a very valuable way that helps to release the trauma in a way that nothing else does, because we're working both with the physical and the psycho-emotional at the same time, and because we're engaging at this quantum level with the patterns that have been imposed into the system. So one other story about fascial unwinding, I saw a young woman, she was 25, she'd fallen over and fractured her right arm, radius and ulnar, both fractured, went to hospital, had it reset, put into plaster, and it healed, except that she was still in pain. Particularly anytime she used the arm, it would hurt, and particularly writing was difficult for her, with the pain coming up her arm into her shoulder and neck, within minutes of starting writing. So this was, of course, very limiting, very difficult for her to get on with life, because pretty much anything she did would bring this pain on. As always, as with most people, she'd been back to doctors, they couldn't help. She'd tried several different therapists. She'd even tried several craniosacral therapists, but nobody who'd used fascial unwinding. So when she came to me, of course, I looked at the whole picture, the whole system, but in view of her injury and the nature of what she was experiencing, fascial unwinding of the arm was clearly indicated. So as I worked with her arm in a similar way to in that video that you just saw, her arm started to twist and perform its own little dance through the air, and it went into all the different patterns it needed to go into, and it found its way into this quite significant twist. And as it did so, she started to feel shaky and she started to feel hot and sweaty. And then it got to this point of stillness, which was the position in which she had been injured. And at that point, she suddenly burst into tears and started shaking quite violently. But she was absolutely happy with that, because she knew exactly what was happening. It was the release of the trauma. And she just felt this great sense of relief, the trauma coming out of her system. And having cried a bit and expressed all this and shaken for a little while, she was then laughing and feeling wonderful, because she could just feel the trauma released from her system. And again, that's very typical sort of picture of these patterns that have been imposed on the body, and she'd been like that for 2 or 3 years before she came to see me. So it was a wonderful relief to have both the physical and the emotional trauma released, so that she could then recover.
Yeah, hi there. It was about the fascia unwinding, but I think you kind of more or less answered it there. I kind of wondered what the trigger was in a session for that suddenly to happen. But is it because you're picking up in the consciousness of where there is a blockage, if you like, or resistance to their body rhythm, and you're putting your...
You mean the trigger for the fascial unwinding to start? Yeah. Or the fascial... Or...
Yes, for that to start naturally in that patient's body.
Well, it does often happen spontaneously. Some people just move very freely, and when you work with them, when a patient comes and you're working with them and you're engaging with those subtle forces, and they're going into a deep sense of relaxation, then sometimes the body will just start to unwind spontaneously. It will happen quite often when you're holding the head and the neck starts to unwind a little bit, because as a craniosacral therapist, you'll be enabling unwinding to happen on a subtle energetic level, internally, on a non-visible level, and then that can translate into more physical movement, particularly if you allow it to happen. Now of course, many people would think it would be a bit weird if their body started unwinding spontaneously. So people tend to stop it from happening and think, oh, I can't let that happen. And so one of the things you need to do with fascial unwinding is to allow it and to make it clear that it's okay for movement to happen. And in a lot of fascial unwinding, the therapist is actually specifically facilitating it, creating the space for it to happen. So for instance, with the arm on that video, I was lifting up the arm, letting it hang in space, but then softening my contact to the point where there was nothing preventing it from moving. So then it would start to move. So the whole process of learning fascial unwinding is, a profound process that one has to learn. It doesn't just happen instantly, but it's something that we learn throughout the training. And on the whole, as I say, it does happen spontaneously, but for the most part, the therapist is going to create a suitable space within which it can happen, so facilitate the process.
Lovely.
Okay.
You. Thank you. Yeah. Cara has her hand up if you're willing, if you're up for another question.
Hi.
Yes, Cara.
Hi. Yeah. Just a quick question. Because I was thinking about the integration experience, kind of, and how the therapist has this kind of calming effect on the patient. But how does this integration affect the therapist? I was wondering if you have to kind of do a bit of tuning out afterwards, and especially because you mentioned like talking about reading the history of the traumatic history of the person. That's so subtle and a lot of information to take in. So afterwards, do you kind of maybe in the training, like, do you talk about tuning out? Because if you are always tuned into all that information, especially when you talk about doing it from distance.
Yes, I mean, that's a very relevant point. Thank you for raising that, because of course it's vital to look after yourself as a therapist, and you do develop a great sensitivity, and you have to be able to manage that sensitivity in order to be able to cope with everyday life. And that's not to say it's anything difficult. It's just a matter of being aware of it so that you do look after yourself. So in a way, there's two aspects of it. One, actually working with a patient, particularly a traumatized patient, and making sure it doesn't leave you feeling traumatized. And the other thing is just looking after yourself day to day. So of course, it's a crucial part of the training right from the start. The first thing we're doing at the moment you arrive is learning to ground yourself, look after yourself, how to keep yourself in balance with everything else that may be happening around you. So we spend a lot of time developing those skills, and they're absolutely crucial. And of course, they're not only crucial to becoming a therapist, but they're wonderful skills to have in everyday life, to be able to just go out into life so much better grounded, so much better able to cope with, the life around you in all its many forms. So yes, one certainly needs to work on those skills. And with each patient, of course, you do engage with their system, and with each patient, you do make sure you bring it to an end, and you make sure that you don't, as you say, tune out. I don't necessarily think of it as tuning out, but yeah, that's a perfectly good way of putting it. That you don't kind of stay engaged with that patient once they've left the room or left the building or whatever. And so yes, one has to have all these resources to deal with that. And then, as I say, one does develop this sensitivity as a craniosacral therapist, which is a wonderful asset to have. But one also needs to develop the ability to manage that sensitivity. And I think one of the crucial points that I feel is vital in working with that, many people talk about shielding themselves from these things and trying to protect themselves from the patient's stuff and the trauma and all those things. My feeling is that it's not so much about shielding, because if you create a shield, then of course you're cutting yourself off from that patient, which is not really what you want. Ultimately, I feel the most significant thing is to clear your own system through craniosacral treatment, personal development, meditation, all the many things you can do to keep yourself in balance. And when you do that, then whatever comes your way, you can just allow it to pass through you. It doesn't lodge in your body. It doesn't trigger your own stuff, because you've cleared your own stuff. Obviously, it doesn't mean you've got to be perfect. Nobody's ever going to be perfect, but you develop all these resources for keeping yourself clear, and then you will manage all these things that arise as they happen.
Thank you.
Okay, thanks for that.
Do you mind if I have one more question?
Absolutely.
Sure. I'm thinking if a patient has a trauma, I mean, if the traumatic factor of the patient persists in his life or her life, how does the treatment succeed? Let's say it could be a toxic partner, or a child that has a narcissistic parent, or somebody that triggers constantly something. How do we deal with it?
Absolutely. Well, I love your questions. They're so profound and so valuable. The only thing is that to answer them, I need several more sessions. So again, I'll have to answer it briefly for you. But yes, it's a great question. We're just about to talk about trauma, so I'm going to explain the physiology of trauma a bit in a moment. But as far as the things that you're mentioning about how the factors in life that are causing the trauma may still be there, that of course is very common. And one has to look at how to work with that as well. And obviously, as a therapist, you don't tell people what to do. You don't tell them they've got to, split from some traumatizing partner that's bullying them or traumatizing them, or, to change their job or whatever, they can't necessarily get away from things all the time. But you, first of all, help them to manage the trauma in their own systems and to release the trauma from their own system. And then through that process, it's also a part of education, of learning how to cope with life, of how to deal with situations. And some therapists are simply therapists. They just do the therapy and the patient feels better, and that's the end of it. The way we work in craniosacral integration, we also do a lot of associated work with trauma therapy, and helping people to understand what's going on, helping people to change their lives in different ways. As I say, obviously not dictating to them what you can do, but again, providing the space within which they can discover how to work with their life and how to change their life accordingly. So once again, it's a huge subject, and I'd love to talk about it for the next few hours, but for the moment, I'll go back to the PowerPoint, explain something about the physiology of trauma, and then we can maybe come back to it a bit more after that. So, trauma we've mentioned several times because, of course, it is absolutely fundamental to health. Everyone is affected by trauma. Not necessarily a major trauma. People tend to think of trauma as some terrible thing that happened, some war or torture or childhood abuse or sexual abuse or rape or something like that. And of course, those are severe traumas, but we're all affected by trauma, whether from birth, whether from childhood, whether family relationships, whether bullying, whether injuries and accidents, or just all the many little traumas that happen in day-to-day life. So we all have trauma in our system. Craniosacral integration is exceptional in its profound resolution of trauma. Again, because we're working at its quantum level, releasing trauma at a much deeper level than most trauma, and because we're working with the physical and the psycho-emotional simultaneously, which is very relevant to any trauma work. So trauma is not just something that happened to you. It's not just an injury, an accident, something that happened to you. It is a physiological process involving the amygdala and the hippocampus, which leads to physiological overwhelm, in which fight and flight or freeze patterns become deeply entrenched in the system, affecting everything about us, our perception, our response, our reaction, our behavior. So in that upper picture there, you can see the triune brain. So the brain is in three parts. The red part is the primitive reptilian brain. So all reptiles have that, basically dealing with survival instincts. The green part is the limbic system. That's the mammalian part of the brain, the emotional brain, which all mammals will have. The purple part is the human part of the brain, the neocortex, which enables rational thinking and such like. Now, the amygdala and the hippocampus are two structures within the limbic system. In this lower picture, you can see them. Those two yellow structures are the amygdalas. Amygdala is Greek for almond. So these two little almond-like structures are there in the limbic system, and they are the alarm system for the body, rather like a fire alarm or a burglar alarm in your house. And so they will sound off the alarm, sending you into fight and flight, telling you to get out of the house quickly because it's on fire. stimulating your sympathetic nervous system into action. Now, in trauma, the amygdalas have been overwhelmed and they are firing the whole time. So it's like the fire alarm in your system is going off the whole time, putting your sympathetic nervous system into fight and flight the whole time, even though there's nothing to be alarmed about. So the traumatized person is overwhelmed. They can't just switch off the alarm. They can't just say, oh, there's nothing happening at the moment, I'm okay. Their amygdalas are telling them that they are in a dangerous place and they should be getting out of it. So it's very overwhelming. That's why trauma can't be dealt with just through rational psychotherapy or even through physical therapy. It needs something that goes deeper than that. Now, the hippocampus, hippocampus is Greek for a seahorse, because the hippocampus is sort of in the shape of a seahorse. And the hippocampus is our memory bank. It's the way that we store memories and keep them in order. Now, in trauma, again, the hippocampus is overwhelmed. It's completely confused as to what's going on. It can't keep the memories in order. So it thinks that past traumas are happening at the present moment. So once again, the traumatized person feels as if those traumas that they experienced years ago are happening right now, and they can't distinguish what's now and what's in the past. So once again, their sympathetic nervous system is stimulated into constant fight and flight, unable to distinguish, feeling alarmed the whole time. And that means that their response to everyday life is constantly overwhelmed, and trauma is determining their conditioning, their response to life, their very nature. So trauma needs healing and integration at a very profound level, not just physical therapy, not just psychotherapy, but the release of shock and trauma at a molecular level, a subatomic level, a quantum level, and reintegration of the whole person, body, mind, spirit, and everything. So we all have trauma in our systems, and trauma is at the root of pretty much all ill health, trauma of one kind or another. It might be birth, it might be injury, it might be a difficult childhood. It could be our parents, school, relationships, bullying. It could be rape, childhood abuse, sexual abuse. It could be war, torture, post-traumatic stress disorder. But it doesn't have to be anything as specific as that. It could just be an accumulation of all the many stresses of everyday life. People will say, well, I've never experienced any trauma. I've never been traumatized, but we all have trauma in our systems. And every craniosacral treatment is treating trauma and releasing trauma. So resolving trauma through craniosacral integration is a very powerful and profound process. So just before I go on, I just want to, again, give a few examples of that the traumatized persons might be apparently able to cope with life perfectly well. The war veteran has survived the war, has come back into civilian life, has built up a business, married, had children. You'd think, well, yeah, they seem to be doing okay. And yet the sound of a car backfiring can send them diving for cover because they suddenly feel like they're back in the war zone again. A firework display would be absolute hell for them because they would just have, their system would be being fired off as if they were at war again. So trauma is very overwhelming, and trauma needs to be addressed at this very profound level. So yes, there's so much more we could say about trauma. I do postgraduate courses on trauma. Obviously, trauma is a major part of the main training. We also deal with it at a postgraduate level, and there is so much to be said about it because it is the heart of craniosacral treatment. So I'd like to move on to talk about the professional training. So I'll do that before we go on to questions as time is marching on. First of all, to see some of the places we use, this is one of the venues that we use for our training. Beautiful place in Hampstead with plenty of space and garden space, both front and back of the venue. Lovely place to do our courses. This is another place that we use, and that's a Tai Chi class that Michael is leading in the morning. We generally do some sort of morning movement before the course starts, Tai Chi or Qigong or yoga or something like that, some kind of movement class, which sets the scene well for being ready for the training day. And then on the training days, you're spending much of your time lying down, treating each other or being treated, which of course is a wonderful way to spend your training, a lovely way to study. and very therapeutic as well as very relaxing. And so, yes, that's how you will spend the majority of your training, is in pictures like that. Of course, there is anatomy to be learned as well, and skulls to be studied, and books to be looked at, and we'll cover that as well. And we have a wonderful team of tutors who will be looking after you the whole time. Plenty of, a good ratio of tutors to students, tutors circulating the whole time to help you as you go through your practical sessions, and available at all times between and during the courses. And we also run study groups and practice sessions of various kinds, both at our centre in Primrose Hill, and particularly recently we've done a lot of online study groups as well, because of course during the lockdown we weren't able to do the live ones so readily. So we provide plenty of online support as well as live support between the different stages of the courses. That picture is actually a study group that we were doing in Hungary for the training that I run in Hungary. And if you've considered doing the training, you've perhaps already looked at the website and seen some of the options. You may have seen that we run a 1-year professional training, which consists of six-day stages, a 2-year professional training, which is exactly the same training, but in a weekend format. So each 6-day stage is divided into 3 weekends. So obviously it takes a bit longer, but the advantage of that is you can do it while working full time, or some people just prefer to take longer, although the 1-year professional training is absolutely adequate and very effective as a training. And then we also run an anatomy, physiology and pathology foundation course. As a craniosacral therapist, you will need a knowledge of anatomy, physiology and pathology. Some people already have that from a previous training, so they wouldn't need to do that again. But if you don't have that background, you would need that. And these days we do it as an online course, which makes it much easier. And of course, it is a very suitable course, suitable for our needs. There are many different anatomy, physiology and pathology courses of different levels. Some are too simple, some are more complex, and you don't need excessive complex or to be too simple. But our course is, of course, the appropriate level and will be attended primarily by craniosacral therapists. We'll talk about that a bit more in a moment. And then, of course, we also provide postgraduate courses, and we'll come back to talk about those in a moment as well. So the anatomy, physiology, pathology course is created by Martin there, and it's all online at the moment. So you do the whole training online. Martin's provided wonderful PowerPoint presentations, which you study in your own time. He's available for email support if you need it. You do the exam online, you get your certificate. You don't need to attend. You can spread it over whatever length of time you want to take. You can do it quickly. If you want to get through it quickly, you can take however many months you want to, and you can start it any time. You can start it tomorrow if you like, or you can finish it before starting the craniosacral training. You can do it while you're doing the craniosacral training. And then we also run 2 weekends on the anatomy of the craniosacral system, run by Lisette and Carolyn. So obviously you can recognize Lisette there. She and Carolyn provide this wonderfully interactive, enjoyable pair of weekends covering the anatomy of the craniosacral system. One of the reasons we do this course is that most APP courses don't cover the craniosacral system. They won't even mention the skull at all, let alone the detail of the cranial bones and the detail of the fascia and such like. So even if you've done an anatomy, physiology and pathology course, these weekends will provide you with much more specific information about the craniosacral system. And even if you do our APP course, that will be covering fundamental APP, but these weekends will cover the craniosacral system in more detail. It's also very valuable to have these weekends because it's really good to get the anatomy under your belt before you start the training or right at the start. Students always report that having done these weekends, they just feel so much more confident and comfortable, and they can focus on the practical aspects of the craniosacral training more readily. So they'll be happening on September the 11th, 12th and October the 2nd, 3rd. They're online courses. If you're starting the training this year, then they'll fit in with your training at the start of the training, whether you're doing the 1-year training or the 2-year training, or you could do them now ready for the future. Or if you're doing the 2-year training, you could do the first one now and the second one next year. Our fascial unwinding courses, we present partly, we teach fascial unwinding on the main training. So if you're doing the professional training, you don't particularly need to do these fascial unwinding courses, but they are also available to non-craniosacral therapists. So if you wanted to do them as separate courses, you can do them as well. We've done them fairly recently, so the next live in-person ones will be early next year, 27th of March and 15th of May. We also do an online 4-day training in fascial unwinding, which again, you wouldn't need if you're doing our training, but which teaches fascial unwinding without the craniosacral training. We did that very recently, just finished last month, so we haven't set the dates for the next one of those yet. As I said, we have a wonderful team of tutors, about 20 tutors altogether at the training at the college. We generally have around 20 to 30 students on a course. We'll have about 5 or 6 tutors on each training. So we have a good ratio of about 1 to every 4 or 5 students. So you get plenty of attention. Every student will work with tutors several times during the training, and you have huge support the whole time. As I mentioned, we have the study groups, both live and online. One of the things about this training is that you have teaching clinics, which are absolutely crucial. There are many craniosacral trainings which don't include any clinical experience, which I find remarkable, really. To train people and then not give them any clinical experience or sending them out into the world seems to me not really appropriate. So in our training, you will get clinical experience during the latter part of your training. So by the time you finish, you will have plenty of clinical experience. You'll have the confidence to go out there and treat patients. You'll have treated members of the public during your training so that you're ready to treat them in your private practice. We have a tutorial system so that you have your own personal tutor who will look after you, and you can contact the tutors anytime you want. We will also do a project in the second half of your training, which is a very valuable process. It's not some academic process that is just a chore. Students always report how it's one of the most valuable aspects of the training, because it is worth looking at yourself and looking at how you can become a better therapist and how you can transform your life to become a happier, more contented, more effective therapist. So it's a wonderfully supportive part of the process as well. You also have my 2 textbooks to support you, the Cranio-Sacral Integration and Face-to-Face with the Face. They provide you with most of what you need for the training. We also provide course notes for some of the other parts of the training that aren't covered there. And we have a library of other relevant texts. Although those books provide you with pretty much everything, the theory, photos of all the contacts, the hand contacts, lots of case studies, pretty much everything you need. But we do encourage you to read widely as well and develop as much experience as you can from other sources as well. And then you'll reach graduation, and we have a wonderful graduation day, a huge celebration with wonderful guest speakers and all sorts of excellent things to enjoy. And you'll receive your diploma and graduate. And once you've graduated, you can become a member of the Cranio-Sacral Therapy Association. And you will be able to use the letters registered craniosacral therapist, or the letters RCST, showing that you're a registered craniosacral therapist. And there are only a few colleges that enable you to join the Cranio-Sacral Therapy Association. There used to be a couple of other major ones, but Karuna has now stopped teaching undergraduate courses, and CTT is no longer accredited because of some issues they had. There are a couple of other more recent colleges, but our college is the most established training that still enables you to become qualified as a part of the Cranio-Sacral Therapy Association. As I mentioned, we also run postgraduate courses. That picture is taken from the trauma course that I ran last year. Doesn't look too traumatic, does it? These courses tend to be great fun, and one of the great things about craniosacral therapy is you can go on learning and enjoying learning forever. There's just so many wonderful things to learn, and every training is development for yourself as well. So it's just wonderful to be able to go on doing craniosacral therapy and more trainings forever. We have our ones on trauma, on dentistry, on babies and children, on emotions, on all sorts of different things. And you can also do a postgraduate course with other colleges as well. So why might you want to train as a craniosacral therapist? Well, you may already have some ideas since you've come to this talk. Many people come because they're looking for a life with deeper purpose, value, and satisfaction. One of you mentioned at the start that you've been working in IT and you wanted to do something else. That's a very common situation. People from office jobs, from teaching, from IT, from solicitors, and they just feel this is not really what I want to be doing with my life. And craniosacral therapy is just so rewarding. Not only are you helping people to become healthier, happier, more contented, providing health and well-being, but you yourself are becoming so much healthier. You spend a lot of your time in a meditative state, both during the training, but also as a therapist. You're spending your professional life in this beautiful, peaceful, still, meditative state, while helping other people to heal and become more settled and still and healthy. So it's a wonderful way to spend your life, and it does bring so much greater value and satisfaction to life. Some people come because they want to help in a specific field. Many people come because they want to treat babies and children, particularly parents who have seen the results with their own children, think this is something I'd like to do. Particularly those who have seen the results with disabled, perhaps their own disabled children, or just seen the work with disabled, or who are working with disabled people in physiotherapy or some other therapy, and see that craniosacral therapy can be so much more profound and effective. And just therapists generally who are seeking a more profound approach, massage therapists whose hands are getting tired and whose bodies are getting tired, and think I can just do something much more gentle and have more profound results. Or we get dentists coming on the course who recognize that craniosacral therapy will not only be a much easier therapy to practice, but can change things in dental patterns and cranial patterns so much more effectively. About half our students are already therapists. The other half are non-therapists, people coming from all those other backgrounds. As I say, the office workers, the ITs, solicitors, musicians, dancers, people from all walks of life. And the training is open to absolutely everybody who is able to do that, whatever their background. And so whatever your background, it's fine. If you don't have a therapeutic background, you will need to do the anatomy, physiology, and pathology, but that's easily incorporated into the training. And for many people, it's just a major part of their own personal journey of transformation. People may start with yoga and then start doing meditation and then try some different therapies, try some acupuncture, looking for something for themselves, trying to sort out their own health issues, their own emotional issues, and they go through various different things, and then they discover craniosacral therapy, and that is often the most transformative part of their journey that really changes everything for them. So particularly doing the training, I mean, receiving craniosacral therapy can be transformative, but doing the training is even more transformative and really changes people's lives in a very profound way. So you can become a craniosacral therapist in order to transform your own life, but also to transform the lives of others. So why might you choose this particular college? It's College of Cranio-Sacral Therapy. Well, firstly, we're the most established college, the first college. And so we have many years of experience, 35 years of experience, and very experienced tutors at the college. One of the most significant factors is because of our integrated approach. There are trainings that call themselves biodynamic trainings. There are practitioners who call themselves biodynamic practitioners. There are biomechanical trainings, such as the up-ledger training and a lot of osteopathic trainings as well. Our approach, our integrated approach, integrates the whole spectrum. We appreciate the value of biodynamics. Our course is primarily biodynamic, but we also appreciate the value of biomechanics. So rather than restricting ourselves to one, we recognize the value of the whole spectrum. We recognize that some patients benefit from one approach, some from others. By understanding the whole spectrum, we can respond to each person and we can bring in the full resources that are available. Biodynamics, biomechanics, mindfulness, fascial unwinding. As I say, Very few craniosacral trainings treat fascial unwinding, and it's hugely valuable. Very few craniosacral trainings incorporate mindfulness, and that is such a valuable aspect of life. I see many patients who have received a lot of biodynamic work, and it's helped them, but something hasn't been helped. It hasn't sorted out their issues. They needed something more biomechanical. I've seen many patients who've had plenty of biomechanical work, and it's helped them, but it hasn't quite gone far enough. They needed something more biodynamic. When you have the full range at your fingertips, you can really help people much more comprehensively and profoundly. Another benefit of this training is that we have both a 1-year and a 2-year training. Most trainings don't have that option, and it's great to have the option so you can work with whatever suits you best. Some people prefer 1, some people prefer the 2-year. If you're working full time, the 2-year is good. If you're able to do the 1 year, then that works well. If you just want to get on with it and do it as quickly as possible and you have the time to spend, then whichever format works you best. So it also provides you with very thorough preparation for professional practice. As I mentioned, the clinical experience is not provided by a lot of trainings, and that is crucial. So we help you to be ready for practice in many different ways. It will enable you to qualify as a registered craniosacral therapist, to be a part of that register, to use the letters RCST, and to join the Cranio-Sacral Therapy Association. As I say, it's suitable whether you're already a health professional or whether you're looking for a career change. You get a huge amount of support in this training, far more than most trainings. The cost is relatively low, but most significantly, it is profoundly transformative. Wherever you are at present, whatever you've done in the past, this training will transform your life. Every year, as students graduate, in the final circle, as we ask people what they thought of the training, everybody will say, this training has transformed my life on every level, personal and professional, physical, mental, emotional, and spiritual. It is profoundly transformative. So if you want to transform your life and transform the lives of others, you know where to go. So if you want to find out the precise dates for our courses, the best thing is to check the website on www.ccsT.co.uk for our current dates. As you can see here, we run regular introductory days throughout the year. You don't need to attend an introductory day. They are intended as a way of finding out more about the training. If you already know that you want to attend, you can go straight into the training. But if you want to find out a bit more, then you can attend an introductory day. They are very practical days. They're a very clear representation of what the whole training is like. And we also run a 6-day introductory course, which is a more comprehensive introduction, also very practical, also very representative of the whole training, if you wish to find out more before you commit to the whole training. And that takes place in July each year. And that 6-day course is also the first stage of the 1-year training. So if you attend that, you can then continue with the second stage of the 1-year training or the second stage of the 2-year training. So the 1-year training, therefore, also starts in July each year. The 2-year training in the weekend format starts in October each year in London. We also run the 2-year training in Manchester, which starts every 2 years, and we also have a 2-year training in Hungary and in Poland. Our Anatomy, Physiology and Pathology foundation course is now an online course, so you can start that anytime you wish. It's completely online, so you just take your own time to complete it whenever you wish. And you can start tomorrow, you can do it before the craniosacral training, you can do it concurrently with the craniosacral training. And then we also run 2 weekends on the anatomy of the craniosacral system. These are also online. Part 1 in September, Part 2 in October, and they are a very useful preparation for the craniosacral training. So they take place around the time of the start of the training. I just see Rosie's put on the chat is the 2-year course in Manchester. We run the 2-year course both in London and in Manchester. So for those of you who are in Manchester, if you want to do your 2-year training, you can do that in Manchester, or anybody up in the north of England. The 2-year training in Manchester will be starting in February, but we've got an introductory day on the 18th of September in Manchester. So if you're interested, you can come to that introductory day and you can do the training there if you prefer. So yes, what other questions? Yes.
Right, can I just ask, how academic is the course? And there's obviously, you mentioned there's reading and there's a lot of hands-on work, but just in terms of, you know, study time, what you have to do,
yes,
how you're assessed.
Yes, it's not a highly academic course. You certainly don't need to be academic in order to take it. We find that a great many people who make excellent craniosacral therapists are not particularly academic, often have a different kind of learning way of working, maybe learning difficulties or dyslexia or just, you know, learning differences. And so you certainly don't need that to be a good craniosacral therapist. Often those people are the greatest healers and the most intuitive people. So the course is not intended to be academic. Obviously, as I say, there is anatomy, physiology, and pathology, but we teach it in a very user-friendly way, and you know, with lots of different resources. In terms of study time, you know, you obviously need a bit of time. That will vary from person to person, but probably a maximum of 3 hours a week would be fine. It's mostly the emphasis on practical work and developing your practical skills. And most of the anatomy and other stuff tends to be absorbed through the whole way that we teach the process. So yes, you don't have to write essays, you don't have to do anything like that. Yeah, we give you things to learn and things to study in order to guide you as to what to learn. We don't do tests as such. We have regular quizzes, which are kind of interactive things just to help you look at different questions and see what questions might be relevant. But yes, it's all very user-friendly, as I say.
Thank you.
Okay.
May I ask one other
absolutely.
question
As many as you like.
With the 1 year versus the 2 year training, if you started the 1 year training and you managed to work the sort of the blocks around your job, but found that was getting too difficult to manage, can you then switch at some point onto the 2 year training?
Absolutely, yes, it's very flexible. You can switch from 1 year to 2 year. You can defer for a year. You can do different ways and different things. You can, if you're doing the course in London and you miss a weekend, you could do the equivalent day in Manchester or the other way around. There's all sorts of ways of catching up. It does, of course, depend a bit, which bits you miss and what stage you want to change and how the two courses are running, concurrently or in sequence or whatever. But yes, there's plenty of adaptability in that.
Great, thank you.
Sorry, just one more question. Amy, I know there's the introductory course, which is 6 days, but for the introductory day, is attendance of that necessary to take the course?
No, neither is necessary. The introductory course is basically really to try it out and see if you like it. So if you already know you want to do the 1 year course, or you want to do the 2 year course, then you can go straight onto that. And that's probably what most people do. But people come to the introductory day in order to find out if they, how it is, and to see how we run things. And it's a very practical day. It's very typical of the training. So yes, it's very representative of the way we teach. But if you already know that you want to do the course, then you don't need to do the introductory day.
Okay, thanks.
With the training with the 6 day blocks around, say, a full-time job, is it doable to go back to work after that time and just fit in little bits of study throughout your week in between, or would that just be too overwhelming?
I did that. So when I did the course, I did the 1 year course. I was working full time and I used all of my annual leave and toil and creative working days in that way. I would say it goes from a Saturday to a Thursday. So I would definitely recommend to take the Friday off. But then I would be fine to go into work in the following week without an issue. But but it does kind of feel like you're on a different universe for that little pocket of time, especially since you're with the same people, at the energy of the room, everything's quite intense. So I would say going back into a 9 to 5 or whatever you're doing, at least that's what I was doing. And it felt a little bit alien. So it was nice to have the weekend to ground and maybe get a professional treatment afterwards and just, yeah, kind of ease myself in. But it was possible to do it. Sometimes felt a little bit more crunch for time than others. And then after the course is finished, I just didn't know what to do with all the time I had left that didn't involve clinics and studying and everything. But it is doable. So but I think, you know, you can also see how it goes, balancing the 1 year in work, which is what some people do, and then might find the 2 year a little bit more easy with the schedule, or, you know, just but I was impatient and I wanted it to get it done in a year's time, so I pushed ahead with that. But yeah.
Yeah, and a couple of other points on that. I mean, obviously it is demanding on time, but on the whole, the course is very therapeutic as well. Remember, you're spending a lot of your time treating each other, and so it's not like you're spending those 6 days working hard when you're on the course. You are in a way working, but you're also receiving a lot of treatment and you're progressing. And also that helps you then to deal with the rest of life, to deal with the rest of your working life as well. And the other thing to say is that there's always the option, and as Lisette says, you can try it and see how it goes. You could do the first stage and, you know, and the second stage and the third stage. And if you find that it's difficult to fit it in with your life, you could then, after 3 stages, say, well, I think I'll take a break now because I haven't got the time, and come back to do the other 3 stages next year. Or you can switch to the 2-year course and continue from there. So if you're keen to do it in 1 year, but not quite sure if it's, you know, how it's going to work, I'd suggest trying it, seeing how it goes. And then, as I say, it's flexible to adapt if you need to.
So if you have a big gap in between learnings for whatever reason, you won't necessarily need to start again. You can just continue.
You certainly wouldn't need to start again. And although in some ways it's a gap in the training, it wouldn't be a gap in that so far as you would keep practicing all that time. You would have plenty of skills that you could be using. You'd continue to interact with your fellow students so that you and you can still do sort of study groups and things like that. So you know, it can be even beneficial that you have more time to develop and progress and get more practice. So yeah, it wouldn't be a hindrance at all, and you certainly don't need to start again.
Great, thank you. Can I just also ask about the fascial unwinding? You mentioned that there was some additional weekend courses for that. So if that's part of the course, would it be an additional benefit to also join those weekend classes, or is it the same thing?
You would be covering everything on the training, but what we find with the fascial unwinding is that many of our graduates either like it so much that they keep wanting to come back for more, or they feel they haven't quite mastered it, they didn't practice it enough, and so they're very keen to come back and do those weekends again. And so that's really partly why I created those weekends initially, was that a lot of graduates were saying, you know, we haven't kept up our fascial unwinding, we really want to do it, and so they wanted to come back to it. But it is also open to people who have not done fascial unwinding before, and so particularly the live in-person ones are great. And again, people come back just because they love doing fascial unwinding. They want to have a day or two of unwinding each other and being unwound because it's such fun and so therapeutic. So you can come back to it, and even though you've covered it, I mean, it's the same with any learning, really. If people come back to the course and say, oh, I really like that bit that you've added to the course, and I say, that's not been added to the course, that was always there, because people don't take in half of what they're taught on a course, even though they've been taught it, even though they've experienced it, even though it's in the books and everything. So people come back to do it again and again, just because they're always going to learn more tips, and different things happen each time. The online course, again, we just found lots of different things happened on the online course that we hadn't happened before. So there is new stuff there. So you don't need to, but you're very welcome to come back to them if you want to.
Thank you.
Okay, so Lizette, you mentioned a little bit about yourself, your history, as a social worker. You want to say just a little bit more?
I came from a background that was non-anatomy, non-body work. So I really came in from a social work background, but wanting to, like some of you had said, transition from a job that was quite demanding to one where I could still work and help people, but that was, as Thomas had mentioned, kind of feeding me at the same time. And that was, I'm doing my 8th year now with the college. And so, it was such a transformative experience to be able to really let go into the work. And as Thomas had mentioned, with all the work that we do on ourselves as well, I could not be a practicing craniosacral therapist, and I still would have felt like it was worth all of, every moment of time that was put into it, because it did really help me get to the core of myself in a way that I hadn't been able to before. So, just, maybe I'm preaching to the choir, but it's a hugely transformative course. So would definitely encourage anybody that has any inkling to at least try out the intro day or to try out the hands-on work and see what it's like in that environment and take part in that, because it's beautiful work. So yeah.
Great, thank you for that. Okay, any last questions?
Probably hundreds. So are you happy for us to email?
Absolutely. do get in touch. Yes, there are inevitably hundreds of questions we can go on asking forever. So do feel free to get in touch at the email address. You can email me and Lizette at the college. And any questions you have, whether it's about the course, whether it's logistics, whether it's about accommodation, or how to fit things in, or whether you need to do the anatomy, physiology, and pathology. We also have our clinic at Primrose Hill if you want to sample a treatment there. And we have a low-cost clinic there if you want some low-cost treatments, if you're within reach. So yes, do keep in touch, and I hope to see you all in due course on one course or another. Have you enjoyed your evening?
It's been fantastic. Thank you very much.
Great. Well, thank you for being here. It's been lovely to have you here, and I look forward to seeing you.
Thank you.
It's great. Thank you so much.
Good night. Bye. Thank you.